The physicochemical properties of a drug can affect how it's absorbed and processed by the body, and the anatomy and physiology of the body can in turn influence the amount of drug and the length of time the drug interacts with its target. The plasma concentrations, duration, and effectiveness of medications that make their way to the small intestine can be influenced by two processes within the body: first-pass-metabolism and enterohepatic circulation. First-pass-metabolism can lead to lower concentrations in the blood and reduce an orally administered drug's bioavailability. Bioavailability is a measure of the fraction of taken drug which makes its way into the general circulation. Drugs taken orally are delivered to the stomach and then to the small intestine. Because of the small intestine's large surface area, the majority of drugs are absorbed across the epithelial cells that line this tissue. The portal vein is the main vessel that collects the blood leaving the GI tract, and it leads directly to the liver. As a result, drug, which is demonstrated in orange, is absorbed in the small intestine and delivered directly to the liver before reaching the rest of the body. Many drugs are biotransformed or metabolized as they pass through the cells of the liver. Drugs which are biotransformed are chemically altered and often do not have the same effects as the parent compound that initially entered the liver cells. As a result, the amount of the parent compound that enters the general circulation is reduced. A drug which is biotransformed to a significant extent prior to reaching the general circulation is said to have undergone first-pass metabolism. Drugs which do not undergo first pass, as indicated by the green color, will require a relatively lower oral dose than those compounds which have undergone first-pass metabolism, and these drugs have a higher bioavailability. The second process that may alter the plasma concentration and the duration of action of drugs is their sequestration into the enterohepatic circulation. Here, as indicated in the pink color, some drugs or drug metabolites that enter the liver through either the portal vein or the hepatic artery can be transported across cells lining the bile ducts and into the bile. They may travel to the gallbladder and then be secreted back into the small intestine, where they will be reabsorbed back into the portal circulation and recycled back to the liver. A drug that cycles repeatedly through this pathway is removed from the general circulation and therefore is not available to exert its pharmacological effects. As such, this path is called the enterohepatic reservoir. This can both decrease the intensity of effect of a given drug and also extend its duration of action. If a proportion of drug cycles repeatedly between the intestine and the liver, it is not available to enter the general circulation for distribution to its potential target.